Welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. As always, the Time of Your Life is about sharing resources for living your best life and dedicated to keeping you well informed about the programs and services that are especially designed for you. You can also connect with BCDA through our agency's multimedia platforms that include our website, Facebook, the Time of Your Life Digest, Flickr, and Map, as well as an abundance of printed resources. Today's show features a variety of fun and useful information for this holiday season. We'll learn about how the Because program facilitates free home improvements for older adults in Baltimore County, allowing them to age in place with comfort and dignity. Then we'll learn about some wonderful holiday gift ideas with representatives from Senior Box Office and Senior Craft Gallery. But first, we begin today's show with a popular and important topic, especially during this time of year. Yes, you've guessed it, Medicare open enrollment and benefits. Let's start the show with Allison McMichael-Dahl of the State Health Insurance Assistance Program named SHIP. Allison, thank you for being on today's show to tell our viewers about the Medicare open enrollment.
Absolutely. I'm glad to be here, and thank you for having me.
Prior to starting our conversation about Medicare Part D, can you briefly share the responsibilities of the BCDA SHIP office?
The Baltimore County State Health Insurance Program, also known as SHIP, office provides objective, non-biased education and assistance to individuals eligible for Medicare, their caregivers, and the family members, as well as the people with 25 months of Social Security disability. We assist with anything between reviewing coverage options, Part D prescription plan selection, Medicare billing help, and screen individuals for Medicare savings programs such as QMB, SlimB, Extra Help, and SPDAP.
Allison, SHIP provides an invaluable service to Medicare beneficiaries. Let's begin by talking about Medicare eligibility and enrollment. What are the basics that viewers can be aware of?
Those who are turning 65 or have had Social Security for up to 24 months are eligible to enroll in Medicare. The initial enrollment period, also known as an IEP, is a total of 7 months. That means there's 3 months before their 65th birthday, the month of their 65th birthday, and the 3 months preceding their 65th birthday is their initial enrollment period where they can sign up for Parts A and Part B through Social Security Administration. They can make an appointment to go in person. They can do it online at Medicare.gov. This is also a great time to get your Medigap and supplement plans. You definitely want to pick it up during this window. If you miss the opportunity to pick up a Medigap plan now, you may not be able to get one in the future. If you do miss your initial enrollment period for Parts A and Part B, there is a general enrollment period, which happens January 1st through March 31st. It's important to note that if you are missing your initial enrollment period, you may face a penalty if you do have to sign up during the general enrollment period.
It sounds like older adults have more choices than ever when it comes to Medicare. Can you further clarify the differences between original Medicare and the Medicare Advantage plans and the pros and cons of each?
This is a great question and one that comes up very often. Original Medicare is Parts A and Parts B. So it's traditional. This is the program that runs by the federal government, and it includes Part A, which is your hospital insurance. So that covers inpatient hospital care, skilled nursing facility, hospice, and some other health care. Part B is your medical insurance. This covers doctor visits, outpatient care, preventative services, lab tests, and durable medical equipment. How it works: you can go to any doctor or hospital in the United States that accepts Medicare. No networks or referrals is required. You can also add a Part D, which is your prescription drug plan for medications, and a Medigap supplemental to help pay for the out-of-pocket costs like the deductibles and the co-insurances. Some pros about sticking with original Medicare: you have broader network coverage, so freedom to see any provider that accepts Medicare. You often do not need a referral to see any specialist. It's also predictable benefits and government oversight, and it works well for people who travel frequently or live in multiple states. Some cons to just having original Medicare: no out-of-pocket maximum, so your costs can add up pretty quickly. It does not include dental, vision, or hearing coverage, and separate plans may need for a prescription drug plan, a Medigap, which means multiple premiums. Um, Medicare Advantage, also known as Part C, is a plan that that is a private insurance companies approved by Medicare. These are plans that combine parts A and B and usually include part D and some other special things. Most plans are HMOs or PPOs, meaning that you typically need to use doctors and hospitals in the plan's network. Extras often include dental, vision, and hearing benefits, gym memberships or wellness programs, over the counter allowances, so for if you're over counter drugs, sometimes transportation to appointments, and additional things such as meals if you end up coming out of the hospital and you need assistance with meals. Some pros, one plan and one card for all coverage. So that would be your medical, your drug, and all the extras. Many plans have low or zero monthly premiums, though you still have to pay for your Part B premium. It includes out-of-pocket maximums, which protect you from overly over medical cost, and often includes extra benefits to original Medicare does not. Some cons, you must use in-network providers. You may pay more to if you go to a provider that's outside of network. May require referrals and specialists. Coverage can vary by county or region, or moving can affect your plan, so you'll have to change that. And cost and benefits can change yearly, requires annual review during open enrollment season.
So, from what you said, Medicare is broken down into a variety of different parts, which
Mhm.
I'm sure can be confusing to our viewers. Can you please provide a brief description about each benefit and what they cover?
Absolutely. So we've already kind of talked about parts A and parts B. Your part A is your hospital, your part B is your medical, and then you have your drug plan, your prescription drug plan. You have a supplemental plan, which is actually a plan that could be a variety. I believe there are 12 plans that are offered in the state of Maryland that we can use, and they all have different letters, but they all have each plan is the same and they all offer the same platform. So if you have an A platform, it might be sold to you by a different private insurer provider. However, it's the same plan for every private provider that's selling it to you. And then you also have your part C, which, like I said, is like the cupcake with all the sprinkles on top of it. So it has your part A, your part B, and all of the additional things, your drug plan, hearing, vision, and all of the great things that come with that.
So, Allison, I'm sure our viewers see ads on TV mentioning Medicare Advantage programs have a give back program alluding to Medicare Advantage plans having little to no copay. Can you please address these programs?
Yes, these TV ads, they claim that you can get money back in your Social Security check or get Part B for free. These ads are referring to what known as a Part B premium give back or a Part B rebate, a feature available in some Medicare Advantage Plan Cs. What it really means is every person with a Medicare pays for a Part B premium. In 2026, that's going to be about $206.50. Some Medicare Advantage plans offer a give back, a portion of the premium. Here's how it works. The plan pays for part of it, of your Part B premium on your behalf. You'll see a larger Social Security check each month because less is being deducted for your Part B premium. For example, if your monthly Part B premium is $178 and your plan gives you $50, you're only going to see a reduction of $128 out of your Social Security check.
It's no secret that Medicare changes annually. Allison, could you please inform our viewers as to what the biggest change to Medicare this year is from last?
Absolutely. So there was lots of changes coming down the line in 2026. If you have a Medicare Advantage plan, you'll see an increase of your premiums by about 5.06%. Some other big takeaways is Kaiser is closing three of their plans and launching four new Medicare Advantage plans and four new dual SNP plans, which are special needs plan. Kaiser and Hopkins are also discontinuing their zero premium plans, and then several dual SNP plans are having reductions, like Humana, Aetna, Bravo Health, and UHC. There are other benefit reductions through Kaiser as well as Hopkins. Some other things that we're going to see coming down the line are a lot of deductibles and premium changes. For Part B, the premium change from 2025 was $185. It's now going to be $206.50. The deductible for 2025 was $257. It's now going to be $288. So an increase about $30. Your Part D deductible is also going up to $610. And one of the most important things to know about is your Part D out of pocket max, the catastrophic coverage. In 2025, that was $2,000. And in 2026, it's going to be $2,100. There's also some changes to Medicare savings programs. For example, the extra help copays have changed. And have increased so that your generic drugs are going to be $5.10 and brand name drugs are going to be $12.65. And if you receive the Maryland Senior Prescription Drug Assistance Program, you will be getting some more help for your prescription premiums. It was $75 in 2025, but we're looking at $100 towards your drug premium in 2026.
Thank you for clarifying these available programs for our viewers. Now, can you please explain how viewers can make an appointment with SHIP and what they can expect when they arrive?
We are currently halfway through Part D open enrollment. We're actually going to be ending the season on December 7th. So it's really important that you are making your decisions now so that your plans are going to start ready on January 1st. If you're interested in an in-person appointment, you should make a phone call to 410-887-2059 to make your appointment today. When you come to your appointment, it's really important that you bring your ID, your medication list with you, your Medicare card, and if you do have your prescription drug plan, it's really helpful if you bring that card as well. I also want to encourage you to bring your Medicare.gov login account and password, as it really makes it easy for our counselors to help you assess and review your prescription drug plans and make sure you are in the best plan for 2026.
I'm told the SHIP office releases a monthly Medicare Minute webinar where viewers can learn more in depth about the various facets of Medicare. What sorts of topics do you discuss, and where can viewers find it?
Yes, the Medicare Minutes are 5 to 30-minute presentations that do a deeper dive into Medicare topics like durable medical equipment, what a Medigap is, the difference between original Medicare and Medicare Advantages, what open enrollment is and what does that include. You can view them at the Baltimore County Department of Aging YouTube account. They are put up every month at the beginning of the month.
Allison, thank you for coming on the show to discuss the intricacies of Medicare and how Baltimore County SHIP office can help older adults navigate them.
Absolutely. It was an honor to be here. Thank you so much.
We're going to take a short break, but first, join approximately 8,000 mature adults who subscribe to BCDA's newspaper, The Time of Your Life Digest. Subscriptions are reasonable at $5 annually for Baltimore County residents over 60 years of age and $7 for those under 60 who are Baltimore County residents or those residing in other counties. For information about becoming a subscriber, please call 410-887-3050.
Climbing the steps, going up the steps. They put railings there to help us. And it truly helped me.
Yeah.
Because I'm on the cane now and bad knees, and I'm not able to walk like I used to.
The goal of the Baltimore County Department of Aging is pretty simple, but very impactful. And that is to strengthen the lives of older adults and people with disabilities. And we do that by providing direct services, advocacy, and through connections to resources so that people can live longer lives. Our department is really special in a way that we provide services where we meet people where they are in their aging journey, and we do that through various programming. The BCAUSE program is one of the programs that I'm really proud to talk about because of two things. One, it speaks about our community partnerships to help people age in place, and the second is the impact that it makes.
I tell anybody, if you're in need and you're older, they will help you.
Yeah.
But you got to put yourself out there and let them know. And they'll come right there and help you. They certainly did it for me and my husband.
Yeah.
The BCAUSE program stands for Baltimore County Age-Friendly Upgrades for Seniors. We operate across Baltimore County, serving older adults with home repairs and home modifications that will help them stay in their homes and age in place.
They put this rail in for the shower.
Through the BCAUSE program, we can do everything from roof repair heating and cooling system repairs, plumbing and electrical repairs, to grab bars and handrails in the home to make moving about the home safer.
I filled the application out. They came out and they talked to me and they said I was eligible. And oh my God, my heart, I was so happy about that. And the program had helped us wonderful.
Oh, yes.
Wonderful. We
Absolutely.
lost our heat, we lost our air conditioning, things that we really need.
We know through research that 80% of older adults want to stay in their homes, but a third of them need support in doing so. And that's where the BCAUSE program comes in. It helps with home modifications so older adults can age in place in their homes.
When we can go in and repair the main systems of the home and the roof of the home, and also do modifications that help people to be able to move about their home and their daily activities, we make it more likely for them to stay in those homes as they grow older.
When someone is able to stay in their home, there are 3 reasons why it matters. The first is that they are less isolated and have these social connections in the community and in their families. And the second is the health benefits behind it. You're less likely to have depression or other health risks such as chronic diseases. And the third is economic benefits. It reduces healthcare costs and a strain on our long-term care facilities, which is unfortunately very unaffordable to so many people.
I'm very happy in my home. And I'm not planning to move unless God move me from it. But I want to stay here forever, long as my life. And it means a lot. They came in, want to know what we need and what they can help us with, and which they did. And it was lovely. You don't know how that made me feel. And it didn't take you a year, it didn't take you 2 years. Soon they said they're going to do something, it was done.
We have so many different programs, and the best way to get in touch with us is through the Maryland Access Point, which is our one point of entry to all of our services. You can reach us Monday to Friday through our Maryland Access Point number or visiting our website.
The home repair and aging in place work that we do helps to reduce people's stress levels, people's mental health and physical health improves. And when we are able to assist people with staying in their homes and preserving their homes and passing their homes to the next generation, it helps to lift the entire community.
It was very emotional. Thank you all for it. And you got to be God sent, because it's just that much love that you guys show us. And
He was worried about me not being with him.
yeah,
He thought that I would have to live with my daughter. But if y'all help,
yeah,
truly help.
yeah.
And so that's why we still together. And we've been together for 64 years.
Yeah, nothing changed. Well, she argued with me a little more.
Welcome back to The Time of Your Life. I'm your host, Ethel Rasmussen. Lynnmarie Rosa from the Baltimore County's Senior Craft Gallery joins me now to discuss all of the wonderful products the gallery has for sale. Lynnmarie, welcome to the show.
Hi, Ethel. It's a pleasure and really an honor to be here this morning.
Lynnmarie, can you tell our viewers about the Baltimore County Senior Craft Gallery?
Oh, I sure can. The Baltimore County Senior Craft Gallery is a space or an outlet that seniors in Baltimore County, and you do have to be a resident, who are 55 and older, can come and bring anything that they make with their own hands. When we sign a consignor up, a senior, they keep whatever sells. The proceeds, they keep 80%, and Baltimore County Department of Aging keeps 20, specifically seniors in the Seniors in Need Fund. We have a big classroom. It's well lit. We have a lot of space. We have close to 50 consigners, I want to say, and every day we get more and more. But we do have one requirement when you volunteer to be a consigner, is that you work 4 hours a minimum per month.
So what sorts of crafts can viewers expect to find at Senior Craft Gallery?
I have been crafting all my life, and I have never honestly seen a group of more talented people in my life. We have artists, we have multimedia people, we have watercolor artists, we have acrylic pour painters, we have rock painters, we have weaving, we have people that have looms at home and do weaving, we have crocheters, knitters, we have a lot of jewelry makers. We have a gentleman that makes pens. He has a wood lathe at home, and he turns those pens, they're wood, and then he paints them, and you can write with them.
Excellent. So if an older adult viewing this program is interested in submitting their work to Senior Craft Gallery, what steps should they take?
The steps are very easy. First, they call the gallery. The gallery number is 410-887-5319. And we will hook you up with Susan, who is our volunteer coordinator. And Susan will show the new person around and then have them fill out a few easy papers. And that's it. It's real easy.
Lynnmarie, can you please tell our viewers where they can find Senior Craft Gallery and what hours they're open?
Senior Craft Gallery is located in the Old Loch Raven Elementary School, which is kind of in the complex where the Loch Raven Village Apartments is located.
Okay, Lynnmarie, I'm told you brought some items to showcase today for our viewers. Can you hold them up and tell us a little bit about them?
Sure. Well, let's see. We have a person that does. Oops, it's backwards. We have somebody that does painted rocks. I don't know if you can see that. We have crocheters, and here's a really cute little unicorn hat. We have people that do little needlepoint. You can't see. We have people that do needlepoint, cross stitch. We have a lady that does these really cute little baby booties in all different colors, and we have cross-stitch artists. We do custom. If somebody comes in and they see a pair of baby booties they like, but they want, blue, we'll do that. I'm making a custom baby blanket for a baby that's coming in March. It's going to have little ladybugs on it. So we will take custom orders in some cases. Let's see, we have this is our lady that does weaving. She has a loom, and her husband is the one that makes the lathe pens. So you can see this is a beautiful woven scarf. We have a lady that does quilting, and she does these amazing, tiny, tiny individual, she does placemats and little cell phone bags and napkins and all kinds of little tiny quilting. And then, of course, we have our jewelry makers, and this is a sample of some of the jewelry we do, or she does. We have quite a few of jewelry makers, but this is just a little sample. Let's see, we have so many different things. We have close to 50 consigners. The good thing about the gallery is we keep our prices really low because we want people to come in and have a really nice, pleasant shopping experience and not, blow the bank. So that's a hallmark of our store, is that everything is really reasonably priced, as we want to sell a lot, So.
That is true, and the crafts you shared all look wonderful. I can see the care that went into making them. Thank you, Lynnmarie, for joining us and telling our viewers about Senior Craft Gallery and all of the wonderful products that would make a perfect, heartfelt gift for this holiday season.
You're very welcome. Honored to be here. Thank you.
Keeping with the holiday spirit, we turn now to Christine Bricker from the Senior Box Office, here to tell us about all that is enriching opportunities a gift of membership can bring. Christine, welcome to the show.
Thank you, Ethel, for the opportunity to share with your viewers the joy of being a Senior Box Office member, or as most people call it, SBO member.
Christine, can you please explain what Senior Box Office is for our viewers who may not be familiar?
Sure. We call SBO the Fun Organization. It started over 40 years ago with a request from the Baltimore County Department of Aging for help in distributing complimentary tickets. It has grown so much from these days, and today our volunteers help to distribute tickets to over 500 member households. Thanks to our sponsors, seniors can enjoy theater, concerts, museum lectures, and other events with 2-for-1, a reduced price, or complimentary tickets.
Wow, that sounds like quite the program, entirely staffed by dedicated volunteers such as yourself. What are some of the excursions offered to members of the Senior Box Office?
Well, just recently, our members had guided tours of Second Chance and the Checker Spot Brewery, both in Baltimore, as well as plays at the local community colleges, opera and performances at Theater Project, to name a few. Tickets to the Baltimore Symphony Orchestra are very popular with our members. Our home office is located at 1801 Glenkeith Boulevard in Towson, where we have speakers several months a year. Our last lecture was the day before Halloween on the history of witchcraft. We also have a book club.
So it's nice to see SBO offers tickets to a variety of local cultural events at steep discounts for older adults, which begs the question, how much does it cost to join?
Membership is open to Maryland seniors 55 years and older. Cost for a membership is $25, and that entitles you to 2 tickets per event.
Christine, with the holiday season upon us, is it possible to gift a membership to someone?
Yes, we do offer gift certificates for membership, and they can be purchased on our website at seniorboxoffice.org.
So what about our viewers that are looking for somewhere to volunteer? Does SBO still offer volunteer opportunities?
Yes, we do. We are a volunteer nonprofit that relies on the generosity and skills of our members to keep the organization alive and working. There are often requests from some of our venues for help with ushering. Once you become a member and learn about how we function, you may find a committee or event or other activity that you can lend your skills to.
Those certainly sound like rewarding volunteer opportunities. Okay, Christine, last question. How can our viewers best contact SBO or Senior Box Office?
You can call SBO at 410-887-5399 or go to our website, seniorboxoffice.org, and complete an application there.
Christine, thank you for joining me to tell our viewers about the discounted entertainment opportunities available to older adults in Baltimore County through Senior Box Office. It truly is an invaluable program, and I'm certain that a membership makes a great gift for older adult loved ones.
Thank you. We love spreading the word about Senior Box Office.
And that's today's show. Before we leave, I would be remiss to not thank our sponsors who graciously donated to BCDA's recent Caregiver Health and Wellness Fair. Thank you to Care First, Maryland Relay, Concierge Home Care of Maryland, Aging Together Keswick, Mid-Atlantic Medical Supply and Equipment, Oakwood Care Center, Personic Health, Topwood Financial, and United Healthcare. Please remember you can call the Department of Aging's information line called Maryland Access Point of Baltimore County or MAP at 410-887-2594 with questions pertaining to older adults and persons with disability. This show may also be viewed anytime on Baltimore County Government's YouTube channel at youtube.com/baltcogov with open captioning. That brings us to the conclusion of this edition of The Time of Your Life, a National Mature Media Award winner about the services and contemporary topics that keep you in the know. Until next time.